All right. Well, thank you for everybody for joining us today on Grand Rounds for the Medical Society. Honored to have Zach Long with us today, who most of you probably know as Barbell Physio. Zach is a doctor of physical therapy and a cornucopia of information when it comes to recovering from or prehabbing to minimize injury and discomfort. So it's a real honor to have him here to do a presentation for us today. Zach's been in the game for a long time, and I think started your physical therapy career in a clinic next to a CrossFit affiliate. Is that right, Zach? And kind of how you got into it?
Yeah, really close down the road to a CrossFit gym and just jumped into it and loved it. Came from more of the traditional strength world, so it was very, very different for me.
Amazing. And, I think one of the things that's really exciting for, at least for me personally, is we really push the affiliate as, a health hub of the future, as Zach's been doing this for a long time. And, figured out that he didn't want to work within the traditional sick care system, as one of the founders of Onward PT with a cash pay model. So really have a lot to learn from him in a lot of different areas. But today, we're going to learn about hypertrophy programming for the CrossFit athletes. So without further ado, I'm going to hand the floor over to Zach and let him take it from here.
Awesome. Thanks, Tom. Yeah, so I've been in the CrossFit space for the last 13 years, and I'm also a physical therapist that primarily treats CrossFit athletes. I don't work with, general population people anymore. So I'm excited to talk about this topic that nobody in CrossFit talks about hypertrophy. Like it's almost like blasphemy to talk about hypertrophy in CrossFit. And so let's start with just discussing kind of why that's a little bit of blasphemy. In CrossFit, our goal is to create this broad, general, and inclusive fitness. We're not trying to specialize anything. We're just trying to get a fitter across all the 10 physical fitness skills shown here. Hypertrophy does happen. Like if you train CrossFit and you haven't trained before, you've not ever spent a significant amount of time training primarily for the goal of hypertrophy. If you CrossFit, you will see your muscles do get bigger. But it's really important to understand that that's not the goal of CrossFit, and it is purely just a byproduct of the strength and power training that we see in CrossFit. And before we go deeper into this, I want to say that I don't think that's a bad thing that in CrossFit we don't focus on hypertrophy. I think if we did add in a ton of hypertrophy focus, we would then lose out on time spent training these other 10 physical fitness skills. So I don't want to think that we need to drastically rethink how we do hypertrophy, but there are plenty of times where if CrossFit coaches, CrossFit athletes, medical providers don't understand some of the foundational elements of hypertrophy programming, we can fail some of our athletes. And so I want to quickly review what are the principles of hypertrophy programming, and then more importantly, after we get through what we know from traditional strength and conditioning, talk about how you actually apply it inside of a CrossFit box. So why do we need to understand hypertrophy? This 1999 study is one of those no-duh studies. You kind of get surprised that people raised money to run a research study on this, but basically they're looking at Olympic weightlifters. And no one will be shocked to find that weightlifters that have higher amounts of lean muscle mass tended to perform better. It's the reason why in weightlifting and powerlifting and strength sports like that, we have weight classes, because bigger individuals have the potential to be stronger. And so number one, we need to understand hypertrophy, because a lot of times your long-term strength development does require increased muscle size. You can't continually get stronger without adding more muscle to the human body. I'm not going to nerd out on this slide here, but when we're thinking about getting stronger, you're thinking about neural adaptations, your nervous system, and hypertrophy, actually having bigger muscles. And the way I like to think of this is, imagine you're a construction site foreman, and you have a certain number of subcontractors working underneath you. Your neural adaptations are your ability to get the right subcontractors at the right time, in the right position, with the right equipment to accomplish the task. And you can get more efficient with that. When you get everybody's schedule lined up, you make sure there's plenty of coffee on the construction site, you can improve neural adaptations. But at some point, the job can become so big that having this many workers doesn't help you get it done in a timely fashion if you don't get more workers on board. That's hypertrophy. So both of those are important for our long-term strength development. This was a 2020 study that compared advanced CrossFit athletes to recreational CrossFit athletes. And similar to the Olympic weightlifters, advanced CrossFit athletes possess greater bone and muscle mass and size compared to recreational CrossFit athletes. And this is, again, another one of those no duh. If you've looked at the CrossFit Games, you've noticed that those individuals probably have significantly more muscle mass than almost anybody else that goes to your gym. And they have more muscle mass, which then allows them to be stronger, so that when a CrossFit Games athlete sees 21:15.9 deadlifts at 225, but they're big and strong enough that their deadlift is 500 to 600 pounds, that's lightweight for them. It allows them to not get into like anaerobic metabolism as quickly. Like they are able to work at a lower heart rate as they do those sorts of things because their baseline strength is so high, compared to somebody that is doing 21:15.9 deadlifts and they can only deadlift 315 for their 1 rep max. Like that person is breaking those sets of 21:15.9 down into really small chunks. And so they have more muscle mass that allows them to be stronger, that then allows them to perform better. Now, obviously in CrossFit, since we are also doing monostructural movements and gymnastics movements, there is an upper limit to this. Like you're not going to win the Mr. Olympia, and just because you're that big and strong, you can jump into CrossFit and dominate the sport of CrossFit. But overall, your best CrossFitters have a lot of muscle mass, and it's necessary for them to perform at that high level. Third reason why we need to understand muscle hypertrophy is that people with more muscle mass tend to die less. And so that's kind of important to life. Inversely related, muscle mass and your mortality rates. And then finally, and why I think it's most important for us, is that we really need to understand hypertrophy in the cases of post-injury programming. So when an athlete isn't tolerating maximal loading on a muscle, on a joint, on their spine, and a strength day shows up, I think that's an opportunity. If we understand hypertrophy-based programming, we can still get them moving in the right direction, even though they're not tolerating heavy loads, or your post-surgery clients. So as a physical therapist, I'll tell you that there are plenty of people that get an orthopedic surgery done, and they do general physical therapy for a period of time. They get discharged from PT, they go back into sport or CrossFit, and they have not rebuilt the necessary amounts of muscle mass they need to ensure their long-term progress and health. And that's where I think it's vitally important. Think of like your post-op ACL that still has significant quad atrophy. There are a lot of instances where people get back into CrossFit and they're doing just broad general inclusive fitness, and that doesn't bring up that weak point in their body enough. And I'll have a video example of an athlete that falls into that category later. So before we talk about the X's and O's, like why does CrossFit shy away from hypertrophy as a whole? I think that goes back to when CrossFit really hit the scene. If you look at what the fitness industry was doing at that time, we were in Globo gyms. We were doing nothing but machine-based training, isolation bodybuilding exercises, and low-intensity cardio. And CrossFit comes on the scene, and we take functional movements, and we perform them at high intensity, and we see this massively better return on investment in terms of fitness outcomes from that. And so for that reason, we said, okay, well, all of this stuff didn't work as good as what we're doing now. Let's just discard all of that. And I understand that. But again, there are cases where ignoring all of this is going to hurt us over here if we don't have a little bit of knowledge on hypertrophy programming. So let's start when it comes to muscle hypertrophy with understanding what leads to muscle hypertrophy. And then we'll talk about like really specific parameters. So the Schoenfeld 2010 article here basically said that there are 3 different things that create muscle hypertrophy. The first is mechanical tension. So that's the force that is produced by muscle fibers when they contract. So imagine you're sitting on a leg extension machine and you're extending your knee. The force that you feel through your quadriceps as you do that exercise is mechanical tension. The second one is muscle damage. This micro trauma that happens to muscle fibers with eccentric based loading, so the lowering of different lifting movements, and novel or unaccustomed exercise. CrossFitters are very familiar with this one because we are constantly daily programming. So we're always seeing novel or unaccustomed exercises. And that's why we live sore all the time. Like we're always feeling like one area of our body is sore. That's from the constant muscle damage that we see from these novel exercises.
I think that's a tagline for my new CrossFit t-shirt is live sore.
There's actually a live sore company. Yeah.
Is there? That's amazing.
T-shirt company, yeah. And then the final one is metabolic stress. So that is the buildup of metabolites, lactate, hydrogen ions, inorganic phosphate in muscle tissue as you exercise. We are also really familiar with that in CrossFit. Like this is the burn that you feel when you're doing a large repetition set. So mechanical tension, muscle damage, and metabolic stress. But the really important key that we have to understand as CrossFitters and CrossFit coaches, providers, et cetera, is that mechanical tension is by far the most important driver of this. There's more and more research challenging how important muscle damage and metabolic stress is. And if you think about CrossFit workouts, like your typical Metcon, what you're going to be limited by is often your cardiovascular system. Like your lungs are burning, not that you're hitting muscle failure. Or you feel a massive burn in the target muscle, not that you are hitting failure in the muscle. Or even if you are feeling that massive burn, which is a driver of muscle hypertrophy, it's a smaller driver of it compared to mechanical tension. So the third thing is when we do lift heavy, it's often done at really low volumes. Like you don't frequently see 5 sets of 10 back squats programmed in CrossFit. It's today we're going to build up to a 3-rep max. So we tend to program our heavy loads towards maximal strength, not this middle ground in loading that creates hypertrophy. So overall, that just to me means that hypertrophy or CrossFit is not ideal for muscle hypertrophy. Again, I don't think that's a bad thing for CrossFit. I just think we have to appreciate that for the cases when it does pop up.
And to unpack that, Zach, for us to understand better, it sounds like what you're saying is that a lot of times the burn that we may be feeling in particular muscle groups may be more related to the metabolic buildup stress component as opposed to the mechanical tension component, which we would get from higher rep sets because we're expanding so much cardiovascular effort. Is that a way to think about it?
The burn, I think in part does come from our cardiovascular system already being really fatigued. So that creates a little bit of burn a little bit faster. The burn is the metabolic stress, not the mechanical tension. And that's just a smaller driver of hypertrophy. Now, if you've read a strength and conditioning textbook, you've seen a chart like what we have down here at the bottom. This is what we really used to believe was true when it came to weightlifting. That 1 to 5 reps created strength improvements, 8 to 12 reps was hypertrophy. If you go less than that, you're not getting hypertrophy. If you go more than that, you're only getting endurance. And we thought like there was this magic zone for hypertrophy. There's been a lot of research now that has pretty conclusively said that low loads and high loads create a pretty similar hypertrophy effect. So you could take 30% of somebody's 1-rep max and have them go to failure. And if we hit mechanical tension, if we hit failure, which creates mechanical tension, we will see a hypertrophy stimulus happen. That is going to be similar to lifting 60% of your 1-rep max, which would be putting you doing one set of at 60% to failure would put you in that like 8 to 12 rep range for most people. The key though is that those low loads that we do see in CrossFit quite a bit have to be taken to muscular failure, which again goes back to this slide over here, which we don't usually hit muscular failure in CrossFit. So imagine you're doing Murph, you're doing it partitioned. You know things are going to go downhill really fast if on the sets of 10 push-ups, you hit failure. You do a couple push-ups and you feel a slight burn, you stop so that you can rest 5 or 10 seconds to get back to it. If you hit failure on those push-ups, that would get you into a lot of mechanical tension. It's going to be really hard to recover for that next set. So we actually tend to, in Metcons, rest quickly before we hit failure so that we don't go over the line there. So that's important for us to understand regarding the overall loading there. Low loads can improve muscle hypertrophy, but you have to take them to failure. They're also not quite as good at improving maximal strength compared to heavy loads. Like heavy strength work is specific. We do that in CrossFit since we often train very heavy in our heavy days. When you look at strength and conditioning research, it's pretty clear that more volume is better for hypertrophy. So you'll find studies where they have individuals do up to 30 sets per week for a muscle group. And what they found is the more volume you do, the more hypertrophy you get. The problem is 30 sets per week is like not feasible if you're training the entire body. You can't do 30 sets for your pecs and your delts and triceps, biceps, quads, glutes, etc. Just can't do it unless you're training 4 hours a day. So most of the time people say like the sweet spot is 10 to 20 sets per week is what you'll see most people discuss. For us CrossFitters though, like how do we define sets regarding hypertrophy? Because again, we do, you do a workout like Cindy where you're going to do 20 rounds possibly, you're not close to failure on those. So do those kind of sets or not? So this doesn't necessarily make a whole lot of sense to us or change how we program, but I will give you some practical takeaways from it later. The other issue with all of these research studies, if you dive into it, is I know this is a little hard to read, but here's a page of a lot of different research studies that optimal volume recommendation was based off of. And if you can see right here on the right side of this green box, bench press, back squat and shoulder press, bench press, knee extensions. They're typically doing like 1 or 2 exercises, which again goes back to you can't do 30 sets per week. You can do 30 sets per week if you're only training one muscle group, but you can't do that across the entire body. The next thing from a hypertrophy perspective to understand when we're talking about programming for it is rest periods. So resistance training with both short and long rest periods, so less than 60 seconds or more than 60 seconds, seems to be pretty equally effective when it comes to muscle hypertrophy. So really what I'm thinking of here, and if you start programming extra hypertrophy work for athletes that you work with, is I'm thinking through the exercise that I choose to do. And the exercise dictates how long my rest is. If I'm giving somebody 3 sets of 10 back squats, and we talked earlier about how training close to failure is important for hypertrophy, 3 sets of 10 back squats where you're 1 to 2 reps shy of failure, you are going to be huffing and puffing. Like your cardiovascular system is going to be taxed quite a bit, in addition to the mechanical tension that you created on those muscle groups. So you might want a longer rest period for something like a back squat compared to if you were doing leg extensions. You could do 60 seconds between sets of 10 on leg extensions and be decently recovered. Do sets of 10 back squats, you're going to want 2, maybe 3 minutes. So let the rest periods be dictated by exercise selection. This is what we really have to think of from a CrossFit perspective, is the exercises that we would choose to use when we have an athlete that needs specific hypertrophy. We want to create mechanical tension on the target muscles. And think of the last time you did a strength day in CrossFit, and it was like a build up to a 6-rep max deadlift. When you fail on that last deadlift, or you get the last deadlift rep done, but you can't do one more, you never get done with deadlifts and say, gosh, my hamstrings were what stopped me from lifting more weights. Gosh, my glutes were what limited me. You just think, gosh, I wasn't strong enough to do any more weights or another rep. You don't feel a specific muscle group usually with a movement like a deadlift. And so when it comes to hypertrophy-based programming, you want to choose exercises where you feel that tension on the muscle that you are trying to target. So you probably would use less deadlifts, more Romanian deadlifts, or more seated hamstring curls or Nordic curls, exercises where when you're done with a set of those, you're like, yes, my glutes, my hamstrings, whatever it was, I felt them work. And at the end of that set, it was that muscle group that wasn't going to allow me to do another rep or many more reps. So that's really important for us to understand. We also need to choose exercises that have both a concentric and eccentric loading. So you want to lower the weight under control, lift the weight under control. And so often in our programming, we're using deadlifts and Olympic lifts. Where when you deadlift a weight up, very rarely does anybody control that descent all the way down. Usually we just let gravity take over and get it back down to the ground. And we definitely do that when it comes to the Olympic lifts. Like you might still hold on to the bar, but you're not controlling it at all. You're just letting gravity get it to the to the ground. You want the concentric and the eccentric when it comes to optimizing hypertrophy. So you're not doing deadlifts and Olympic lifts when somebody needs more hypertrophy. You're doing Romanian deadlifts, squats, shoulder presses, etc. Those movements are going to be much better. One thing we do get really right in CrossFit, or two things we get right, are range of motion and the ability to progressively overload. So one of my favorite things about CrossFit is that we are brutal about not allowing pro reps to happen. Like we are going to call you out if you're not getting it done. We understand when some people can't do that, but we want you training through your best available range of motion always. And when you look at research on muscle hypertrophy and range of motion, it's more and more suggesting that longer length resistance training is superior to shorter muscle length resistance training for muscle hypertrophy. So if your goal is to maximize hypertrophy in the quads, we're going to squat all the way down and stand it all the way up. We're not doing quarter reps at all.
Zach,
the other thing CrossFit does really well.
Can you speak also to the importance of if full range of motion and how it decreases risk for injury over time as well, and why that's important?
Yeah, I think there are a couple different reasons why that's important. Number one, you only get strong in the range of motions that you train. So when you neglect a range of motion for a long period of time, you won't see yourself get strong in that range of motion. And strength is so protective against so many different injuries. And then the other thing from a cartilage perspective, like the cushioning inside of your joints, cartilage gets nutrition when you move those joints through full range of motion. Like that's the putting load and going through full range of motion is kind of the stimulus that your cartilage needs to stay healthier. And so if we're not challenging that, it won't have a positive effect on those tissues overall.
Yeah, that's really helpful. I mean, as a coach, right, when we're at the whiteboard and explaining why mechanics, consistency, intensity is so important, right? And people, and you're getting on people, it's like, nope, get below parallel. It's like, it's not, the standard is the standard for a reason. And it's, yes, to make sure that we're creating strength in all ranges of motion, but it's also how we're mitigating injury and optimizing your health span over the course of your entire life, right? So it's about more than just, the basics there. So I appreciate that. Thank you.
You can also think of that like acutely. Imagine two guys in the gym. Imagine you go into a Globo gym and you look in the back corner at the squat racks, and there's a guy in there. He's got like a tank top where he like cut the sleeves off himself. He cut it way too short, so like his nips are hanging out the side. You know what I'm talking about, Tom? That guy?
No, I have no idea.
He puts 500 pounds on the bar. He takes 2 steps back and he does his little bro reps where he barely bends his knees on squats and grunts so that everybody looks at him. When you lift through a partial range of motion compared to full on most exercises, the load that you can use just goes through the roof. And so you are now getting dramatically more compressive loads through the body that I think is super maximal and probably not the best thing for your health as well. So I'd rather you lift a lighter load, get a better hypertrophy stimulus, get a better load through the knee joints, and have less overall compressive loads when you do that.
Safer. Yeah, it makes sense. Thank you.
The next thing that CrossFit does really well is we choose exercises that allow us to progressively overload. Like we choose functional movements, naturally occurring movements that let us move a large load, a long distance rapidly. We don't do tricep kickbacks and lateral raises. We do shoulder presses, bench presses, push-ups. And so the movements we choose, you can continually get stronger or do more reps for years and years on end. So that progressive overload is hugely important for hypertrophy. We also have to think through this kind of abstract concept of stimulus to fatigue ratio. So if we go back up here to the mechanical tension part, think of doing a couple sets of deadlifts versus a couple sets of seated hamstring curls. Like what's going to make you more tired? The deadlifts. So some exercises create more fatigue in the body. And what we want to do is choose exercises that have the max amount of mechanical tension for the least amount of fatigue. That makes that ratio the best. We get the most hypertrophy for the least stress on the body. That's what we want when we're training from a hypertrophy perspective. And so sometimes we really have to think through that. And that is also one of those things that is very individualized. Like some people will feel like Romanian deadlifts wreck them. Other people will feel like, no, that was just a great exercise that made me feel like my hamstrings worked really well. but that's worth noting. One thing CrossFit gets wrong when it comes to hypertrophy is this idea of the repeated bout effect. So the repeated bout effect is essentially this concept where when you do a new exercise or a really different load on an exercise than you've done in a long time, you tend to get really sore from it. Novel or unaccustomed exercises creates more muscle damage, and therefore you end up being more sore. The repeated bout effect is essentially saying when you get that same stimulus again, when it happens multiple times, you tend to see less muscle soreness each time you do it, but you still get the same hypertrophy stimulus, the same positive benefit. And so because at CrossFit, we're always being constantly varied, we're, again, constantly living sore, but what we frequently see is that we're getting that muscle soreness that's not any better for muscle hypertrophy than if we were to just do the same exercises over and over. So I really say that because if you're a CrossFit coach, provider, you start programming hypertrophy for a CrossFit athlete, don't feel like you have to like stay in your CrossFit brain where we're always doing something new and different. There's a lot of value in training the same movement weeks in a row. We'll still get a hypertrophy stimulus. We just won't get as much soreness from it. Kind of your basics of what the research says regarding muscle hypertrophy. But obviously that doesn't smoothly fit into CrossFit programming all the time. So here's what I hope people can like take away from this and how to actually apply it in the box or in your clinic. When I have an athlete that needs more muscle hypertrophy in a specific muscle group or two, I like to try to add 5 to 8 sets per week to their CrossFit training on the muscles that specifically need more size. That is a decent step up in volume, but not, the 10 to 30 sets per week that would then make it really tough for them to recover. 5 to 8 is a good number. Now, this can happen in a number of different ways. So this could be like very isolated accessory exercises. So we just finish a workout a couple days a week with doing 1 or 2 accessory exercises, or at times it might need to be a couple days of dedicated work. I'll give a few examples of this, but I do want to say that it is really important to think through a gym's programming bias when you do this. CrossFit being, a pretty do your own thing in your own gym philosophy here, you see a lot of different styles of programming. You will run into gyms that follow the traditional CrossFit programming where we do just one element per day. That's not a whole lot of volume, relatively easy to recover from. You see gyms that do a strength piece, a skill piece, and a Metcon every single day. When they're doing that much volume, you got to be really careful with how much extra volume you put on top of that because it's already tough to recover from that amount of volume. So you really got to think through that overall. And then at times, I think it's worth noting that full hypertrophy specific programming with dedicated conditioning days might be necessary. So I'm thinking of this with my post-op clients. Like right now, I've got a guy that's 3 months out from a rotator cuff repair and labrum repair. So pretty significant shoulder injury and surgery. He wants to get back to CrossFit, but right now he's got so much atrophy in his upper body that while he could get on the pull-up bar and probably crank some kipping pull-ups out, we would be much better focused on if we rebuilt his muscle mass and worked on his engine separately and got him to where he was back to having the muscle mass he had pre-surgery so that now he can do those movements with control. So at times we have to completely step back from CrossFit. That's rare, but just be aware of that as well. Because CrossFit is intense and we work out at high intensity, it's also really important when we talk about that stimulus fatigue ratio. I am trying to choose exercises that are the easiest to recover from and put the most amount of tension on the target muscle. So 5 to 8 sets per week, that could be programmed a couple different ways, but choose exercises that you can recover fairly easy from overall. Before I give a few practical examples, we also have to be aware of the nutrition demands when it comes to muscle hypertrophy, because I can't tell you how many times I've been the second opinion for somebody that was not happy with their progress after an orthopedic surgery in terms of their rehab. And I had them start tracking their nutrition, and they were so underfueling their body that it wouldn't have mattered what we did programming wise. It would have been physiologically impossible for them to regain muscle mass. So When we're talking about this, I'm a physical therapist. I am not a nutritionist or dietitian. So this is the max depth I go into nutrition with people. If they need more help than this, I actually send them to somebody. But it is important for all rehab providers and clinicians to understand these couple things. From a protein intake, research shows getting between 0.7 and 1 gram of protein per pound of body weight is needed for resistance trained individuals. And so many CrossFitters are under eating on protein, and a lot of your post-op, post-injury people are as well. I tend to actually stay lower on the protein intake when somebody's trying to gain muscle mass and higher when they're trying to lose body fat. You want to keep more amino acids in the bloodstream as their caloric intake's low. That seems to help prevent muscle loss when we're in a caloric deficit. But 0.7 up to 1 gram per pound of body weight. And then you're looking at total caloric intake. And so if I have somebody that I need to put muscle mass on, I want to try to raise their caloric intake by 10 to 15% over their baseline. And then I'm regularly going to track their weight and maybe even taking measurements of the muscles that we're trying to hypertrophy to make sure that we're progressing there. When we start to see that plateau off, then I might bump their calories up again to get them moving the right direction again. But don't skip out on nutrition when somebody needs hypertrophy, because you can have the greatest program ever, but if you don't have enough fuel available to rebuild those muscle mass, you're not going to make a whole lot of progress. I'm going to give you all 3 examples of how this might look with different potential clients that I hope will tie a lot of this stuff together. So number 1, take a workout. We're showing up. The workout today is built to a 5 rep max back squat. So obviously our goal in this workout is maximum squat strength this day. Well, if you have an athlete that shows up 2 weeks ago, they injured their back and it's still really irritable. Like it doesn't take a whole lot of load to really increase their pain. So with that person, you can't take them up to a 5 rep max back squat, but they're still at the gym. They still want to work out. And I think it's good that they want to work out, because if they work out, they're going to be pumping blood through their back, through their legs. That blood pump is going to help a little bit with inflammation. It's going to create an endorphin release. So it's going to drop their pain levels down a little bit. And most importantly, it's going to prevent us from losing the fitness that we worked so hard on. So we're going to at least train the different muscles around that we possibly can. If we understand hypertrophy programming, we might look at that max back squat day, 5 rep max back squat day, and say, okay, we can't get maximal strength, but if we put a hypertrophy stimulus on this individual, maybe we'll make the muscle a little bit bigger, so that then when they're back to lifting heavier, that bigger muscle has the potential to be stronger. So we might just switch this to a hypertrophy day for the quads and the glutes that are the main movers in the back squat. So I might take that workout, pop that individual up between 2 boxes, get a dip belt and hang the heaviest kettlebells or kettlebell combo I can on that individual and have them do back squats. With that movement, the weights in the belt, so the spine is staying unloaded while we get tension put on the quads. So we program 3 sets of 10 to 20 reps. Really, that's going to depend on how much load we can get on this setup, with them going till they're about 2 reps shy of failure, and then they rest for about 2 minutes between those sets. Finish that. Now we do something like a single leg hip thrust. Get another movement where we don't have any load on the spine. The spine might be doing a little bit of an isometric contraction here, but these are 2 exercises that some really irritable back pain clients will be able to do. That are going to train those muscles, pump some blood in their back. They'll probably leave that day feeling a little bit better, and they'll have seen their friends, hung out in the gym, etc. Here's an example of a client of mine. So this guy's a power lifter. He's actually a state champion power lifter, massively strong guy. I believe he's got about a 500-pound squat. I want you all to watch his bar, especially as he does more repetitions here. You notice how that bar leans to his left side. He came to see me wondering what was going on with his squat. He'd seen a couple other medical providers before me, and he couldn't figure out why this hip shift was happening. And so when I started talking to him, one of my first questions was, number 1, are you having any pain? And he wasn't having any pain with it. A lot of times when people are in pain, they'll change how they move. So a lot of times when I see a hip shift, it's because they're avoiding a painful tissue. My second question was, did this change based on the load that was on the bar? And he said, yes. So during all of his warm-up sets, he didn't have a hip shift. but it wasn't until he got up to like mid 300s that bar started to become uneven on him. And you also notice the more reps he did, so the more fatigued he got, the more that bar started to shift. So when he told me that, I had a pretty good idea that it was actually a strength issue that he had, because it changed with load. The more we demanded of his muscle strength, the more the hip shift became prevalent. Well, if you look at his legs right here, you'll be able to see that his right leg there is significantly smaller than his left leg. Like, look at his shorts on that left leg. They're tight. Like, he's got some skinny jeans on the left leg. They're baggy on the right leg. He had had an ACL reconstruction 10 years prior. And this guy, again, a state champion powerlifter, is having this issue. He's done 10 years of strength work since the ACL reconstruction, and he still has that amount of muscle hypertrophy and that massive of a strength deficit. These people are in your CrossFit gyms too. And so I think with this person, if you just keep doing broad, general, and inclusive fitness with CrossFit, that's not going to self-correct itself. And so that's an example of somebody that if he was a CrossFit athlete, CrossFitting 5 days a week, I'm going to say, okay, let's address this weakness, because long-term it will make you a better CrossFit athlete. We're going to take your 5 days a week of CrossFit and we're going to cut 1 day of CrossFit out, and we're going to add in 1 day of hypertrophy training for your quads. We're going to get after that 1.5 inch quad deficit that he had on that one side. So that might look like this for that individual. So he comes in and the first exercise he does is 3 sets of 6 to 8 cyclist squats. So cyclist squats are a front squat where your heels are elevated, your torso stays really upright, it crushes your quads, and it needs a lighter load than a back squat or front squat. So you get a big quad stimulus, but it's not as tough to recover from. Do something like a rear foot elevated split squat, another great exercise that could load his quads, and then do something like bare leg extensions, since we don't ever have leg extensions in a CrossFit gym. But that would be a great day where we're getting 1, 2, 3, 4, 5, 6, 7, 8 sets of extra quad work on that guy's week. And I think if you had them do that for a handful of months, possibly changing the exercises somewhere along the way, you're going to see that individual's muscle mass jump back up and their squat performance and Metcon performance jump up a good bit. Another great example of how I would often use this is just after a normal injury. Doesn't even have to be after a surgery, but take an athlete that's getting back into CrossFit after a 3-month rehab for shoulder pain with rig-based gymnastics. So anytime they're doing pull-ups, muscle-ups, toes to bars, their shoulder hurt, you were able to modify their training for the last 3 months. But when you start looking at their technique, the kip looks like this. You know, the big leg flail, over-relying on the hips to get over the bar. And you're like, okay, I have an idea on why you might not have enough lat strength to actually control the kip. And so instead of looking like nice and tight during all your kipping, you've got that flailing leg issue. So for that individual, I might think, okay, well, I can very easily program some accessory lat strength / hypertrophy work for them that would help not only improve their performance on these skills, but it would also protect the shoulder. I'm huge on when CrossFit athletes have rig-based shoulder pain, I give them lat accessory exercises. I think it's highly underrated in terms of keeping CrossFit athletes' shoulders healthy. So for that individual, twice per week, I could give them just a finisher at the end of a workout to work on lat strength and hypertrophy. I love this exercise right here. It's called ring rack chins. Because the hips are flexed with the feet up on the box, the lats are on a big stretch, but going back to longer muscle lengths being better. You also get to pull the rings apart as you come up, which really helps people feel their lats a little bit more. But once a week, 3 sets of the max number of reps you can do, stopping 1 rep shy of failure. Rest 2 minutes between sets. So you're talking, a 10-minute finisher right here. Once a week, we do this banded row. So that band is resisting our shoulder extending. So it's another really great exercise for feeling the lats work. To give that athlete that combination do one of those each a week, they're now getting 3 sets 1 day a week, 3 sets another day a week. They're getting 6 total sets of extra lat strength and hypertrophy work to help supplement their CrossFit and keep them feeling good. There's a bunch of resources if you want it. For anybody that wants my contact information, it's there. Tom, any questions, thoughts?
Tons. Oh man, that was fantastic. I mean, this is such an important thing for us to remember, right? Because when I step back and think about CrossFit from an overall approach to optimizing health and well-being, like I think as far as getting an ROI, it does a fantastic job.
Mhm.
As you're pointing out, there are situations, right? Post-op, recovering from injury, coming into CrossFit with long-term asymmetry from distant injury or what have you, that can really inhibit our progression over time and lead to injury, right? And so I think us being able to understand that there are going to be times when we need to adjust and step out of kind of the standard methodology to really address discrepancies and asymmetries to make sure that we're moving well is so important to make people reassure people that that's something that they need to do, and to train our eyes to look for that. I mean, the strength guy 10 years out from ACL is such a fantastic example of that, right? I think a lot of us will notice that, and see this when we're coaching in members, that you may not see certain movement discrepancies in warm up, but once they start to get under load, you'll see that, right? And it's surfacing a lot of these strength discrepancies that you just don't see when they're not under load. So that's such a great tip, man. Wow, that was really educational and helpful, Zach. I really appreciate it, dude. Anything you want to leave us with? Any other tips before we wrap up?
No, that was it.
Yeah, man, that was helpful. Really looking forward to your newsletter piece coming out as well. I think it's gonna be really educational. Folks should follow Barbell Physio. A lot of evidence-based resources and information to both rehab, to keep injuries from happening, and if you do happen to get dinged up, it's a wonderful resource for us to access recovery protocols to get you back to doing what you need to do. So, Zach, thank you so much for your time today. Really appreciate it, and look forward to hearing more from you in the future, my friend.
Thanks, Tom.
All right. Awesome, dude. I'll stop the recording here.